Hello. Today I'll be talking about first aid 2021 page number 725. It is from a rapid review, classic or relevant treatments, and it is on section 3. So I have just completed page number 724 from the rapid review, classic relevant treatments, and this is the second video for today. So there are some conditions and some common treatments which I'll be talking in this video. So let's start from the beginning. So the conditions like Candida albicans. In Candida albicans, the common treatment should be topical azoles, and it can be given orally also, some antifungal and systemic also. All right. So talking about topical azoles, it can be given for vaginitis like nystatin. All right. So topical azoles for vaginitis and nystatin, fluconazole, caspofungin, it is given orally. Nystatin, fluconazole, caspofungin, it can be given orally, and fluconazole, caspofungin, and amphotericin B is given esophageal or systemically. All right, fluconazole, caspofungin, amphotericin B, it is given esophageal or systemically. Cryptococcus neoformans, Cryptococcus neoformans, the common treatment will be induction with amphotericin B and flucytosine, and it is also treated by maintenance with fluconazole in AIDS patient. The Cryptococcus neoformans. In Cryptococcus neoformans, the induction with amphotericin B and flucytosine is done. Induction with amphotericin B and flucytosine. Induction with amphotericin B and flucytosine is done, and maintenance with fluconazole in AIDS patient. So now the next conditions: Sporotrix skenki, Sporotrix skenki, Sporotrix skenki, Sporotrix skenki, Sporotrix skenki, Sporotrix skenki. So Sporotrix skenki. In these conditions, itraconazole oral potassium iodide is given. Itraconazole oral potassium iodide is given. Itraconazole oral potassium iodide is given. Pneumocystis jirovecii, Pneumocystis jirovecii, TMP, trimethoprim, SMX, sulfamethoxazole. Prophylaxis and treatment in immunosuppressant patient, and in the patient with CD4 count less than 200. Pneumocystis jirovecii, TMX, TMP, SMX, trimethoprim sulfamethoxazole is given. It is given in immunocompromised patient and in a patient whose CD4 count is less than 200 per mm cube. Toxoplasma gondii. So the treatment will be sulfadiazine with pyrimethamine. Toxoplasma gondii. Malaria. For malaria, chloroquine, mefloquine, otawaquine, proguanil for blood sizoid, and primaquine for liver hypozoid. Primaquine for liver hypozoid, otawaquine, proguanil for blood sizoid. So in malaria, chloroquine, mefloquine, and is given, and also otawaquine, ottawaquone, and proguanil for blood sizoid, and in liver hypozoid, primaquine is given. For liver hypozoid. So next one is Trichomonas vaginalis. For Trichomonas vaginalis, metronidazole is given for both partner and patient. Streptococcus pyogenes, penicillin prophylaxis is given. Streptococcus pyogenes. Streptococcus pneumonia, penicillin or cephalosporin for systemic infection or in pneumonia, and vancomycin for meningitis. Vancomycin is given for meningitis. So penicillin or cephalosporin for pneumonia or systemic infections, and vancomycin for meningitis. So Staph aureus, methicillin sensitive staph aureus MSSA, nafcillin, oxacillin, diclofenac, that is for MSSA. So anti-staphylococcal penicillin, it is anti-staphylococcal penicillin. These are anti-staphylococcal penicillin. Nafcillin, oxacillin, diclofenac. So this is MSSA. For MRSA, vancomycin, daptomycin, linezolid, ceftaroline, vancomycin, daptomycin, linezolid, ceftaroline, vancomycin, daptomycin, linezolid, vancomycin, daptomycin, linezolid, vancomycin, daptomycin, linezolid, vancomycin, daptomycin, linezolid, and ceftaroline for MRSA. For enterococci, vancomycin, aminopenicillins or cephalosporin, and for BRE, vancomycin resistant enterococci, daptomycin, linezolid, tigecycline, and streptogramins, daptomycin, linezolid, tigecyclines, and streptogramins. Rickettsia rickettsii, doxycycline, doxycycline, chloramphenicol, doxycycline, chloramphenicol, doxycyclines and chloramphenicol. Rickettsia rickettsii, doxycyclines and chloramphenicol, doxycyclines, chloramphenicol. Rickettsia rickettsii, doxycyclines, chloramphenicol. Mycobacterium tuberculosis, RIP, Mycobacterium tuberculosis, RIP. Rifampin, isoniazid, pyrazinamide, ethambutol, rifampin, isoniazide, pyrazinamide, ethambutol, RIP. UTI prophylaxis, TMP SMX, trimethoprim sulfamethoxazole, TMP SMX. These are UTI prophylaxis. TMP SMX is also given in pneumocystis jirovecii, and UTI prophylaxis. So next one is influenza. In influenza, oseltamivir and zanamivir is given. For CMV, cytomegalovirus, ganciclovir, foscarnet, cidofovir, ganciclovir, foscarnet, cidofovir, ganciclovir, foscarnet, cidofovir, ganciclovir, foscarnet, cidofovir, ganciclovir, foscarnet, and cidofovir, ganciclovir, foscarnet, and cidofovir. PDA, in PDA, Pectinidactylis arteriosus, it closes with indomethacin and it opens with PGE analogs. And close with indomethacin in the case of Pectinidactylis arteriosus. So in established angina, sublingual nitroglycerin is given. Hypercholesterolemia, statin is the first line. Hypertriglycerides, fibrates is given. Hypertriglyceridemia, hypercholesterolemia, statin is given. Hypertriglyceride, fibrates is given. Arrhythmia in damaged cardiac tissue. Arrhythmia is given in damaged cardiac tissue. Arrhythmia is given in damaged cardiac tissue. It is class 1B antiarrhythmia. Arrhythmia in damaged cardiac tissue. Class 1B antiarrhythmic. Lidocaine, mexilatin, lidocaine. Lidocaine and mexilatin is given in for class 1B antiarrhythmic. Class 1B antiarrhythmic, arrhythmia in damaged cardiac tissue. Arrhythmia in damaged cardiac tissue, class 1B antiarrhythmic. Lidocaine and mexilatin. Prolactinoma, carbigolin, bromocriptin, prolactinoma, carbicolin, bromocriptine, carbicolin, bromocriptine, carbicolin, bromocriptine, carbicolin, bromocriptine, carbicolin, bromocriptine, that is dopamine agonist, carbicolin, bromocriptine, diabetic insipidus, desmopressin, diabetic insipidus, desmopressin, hydrochlorothiazide, indomethacin, amiloride, that is for nephrogenic. For desmopressin is given for central diabetic insipidus, diabetic insipidus, central uh, and nephrogenic diabetes. Okay, desmopressin is given for central for in nephrogenic, hydrochlorothiazide, indomethacin, and amiloride for nephrogenic diabetic insipidus. SIADH. S for in SIADH, fluid resuscitation, IV hypertonic saline, conivaptan or tolvaptan, democlocycline. DKA, hyperosmolar hyperglycemic state, fluid insulin, potassium, pheochromocytoma alpha antagonist, phenoxybenzamine, carcinoid syndrome, octreotide telotristat, diabetes mellitus type 1, dietary intervention, low carbohydrate insulin replacement, diabetic mellitus type 2, dietary intervention, oral hypoglycemic and insulin if refractory. So this is for diabetic type 2, dietary intervention, oral hypoglycemics and insulin if refractory. Diabetes mellitus type 1, dietary intervention, low carbohydrate insulin replacement, carcinoid syndrome.